As we wrap up the lower extremity, we're going to focus on injuries to the foot area. Our first injury to the foot area, we're going to start again with fractures and dislocations as we had in the past. Foot and toe fractures occur to a variety of bones, including the phalanges, metatarsals, and calcaneus. For example, we also have specific fractures in the foot for these injuries, and we have specific names that we give them. So, for example, when we look at fractures at the base of the fifth, we call this a Jones fracture. If we have a fracture that results from proximal metatarsal dislocation, which is typically in the midfoot area, we call this a Lisfranc fracture. We could also have stress fractures that occur from overuse because the person is always weight bearing. And we can also see these stress fractures not just in the ankle and the foot area, but also in the metatarsals. And these metatarsal fractures are also commonly called march fractures because they are, when we look at a person marching over and over again, they tend to get these stress fractures. Foot dislocations, however, are not as common as other parts of the body. When we look at mechanism of injury for an acute foot fracture, we usually have direct trauma to the injury, such as being stepped on by another athlete. For stress fractures, remember it's an overuse, repetitive weight-bearing type of activity, such as bounding or running on the foot. Signs and symptoms are the same for any other fracture dislocation that we've talked about previously. For treatment of fracture and dislocations, for acute, call 911 immediately. Check the athlete for shock, split the foot and ankle in the position that we find it, apply ice, and monitor the athlete until EMS arrives. For stress fracture, we want to treat them with, like any other stress fracture, we want to make sure we avoid the activities that are causing the pain. Use rice, continue weight-bearing activities using crutches or a boot so that they don't walk with a limp. Prevention, we want to make sure that we wear supportive and appropriately fitted shoes. We can also perform strengthening exercises for the lower leg and ankle because these muscles and tendons act on and support the foot for these types of injuries. Retrocalcaneal bursitis, not very common in athletics, but can occur if we're working with an outside population that is not active as much. But retrocalcaneal bursitis is caused by friction on the bursa in basically the heel area. So an athlete who wears tight or poorly fitted shoes combined with repetitive walking, running, and jumping really irritates this bursa and causes it to become inflamed. So signs and symptoms, we have heel pain, point tenderness, and swelling around that backside of the heel. In order to treat this, we want to avoid any irritating injuries, apply ice to the area frequently throughout the day, take anti-inflammatory medications for the pain and inflammation, wear properly fitted shoes and exercise shoes, and then stretch the gastrocnemius, soleus, and Achilles complex in that area. We could also, to decrease some of the pressure on that area, we can get over-the-counter heel wedges for both shoes to kind of bring up that heel area so there's not that friction that causes that injury. Prevention, we want to make sure we wear properly fitted shoes, stretch the Achilles tendon, and strengthen the muscles around that area. Plantar fasciitis is a very common injury in athletics as well as the general population, especially as an individual gets older. The plantar fascia is a thick band of soft tissue that runs from the calcaneus to the metatarsal heads, and it really supports the foot's medial longitudinal arch and acts as a shock absorber as we're weight-bearing, walking, running types of activities. This injury is caused when there is excessive tension placed on the plantar fascia over a period of time. And really what we see is runners that have that repetitive motion of running over and over again are really susceptible and predisposed to acquiring plantar fasciitis. Also, we commonly see this in overweight and pregnant athletes and also those that wear poorly supportive shoes. When we see somebody with plantar fasciitis, the signs and symptoms typically develop very slowly, but one of the telltale signs is that the person has sharp foot pain on the underside of the foot, upon waking up in the morning and stepping down, so they are not able to walk in the morning. This will decrease as soon as they stretch it out. So the pain will decrease throughout the day, but then it will also come back the next morning as well. For treatment, typical treatment for plantar fasciitis is non-steroidal anti-inflammatories, rehabilitation stretches that include stretching for the plantar fascia and Achilles tendon, and ankle strengthening protocols. We could also prescribe, or refer them to a physician so they can prescribe maybe a corticosteroid shot or oral corticosteroids. Therapeutic modalities can also help, as well as a night splint to keep that foot in dorsiflexion compared to the foot relaxing and the tissue, the plantar fascia, becoming tight. Prevention, wear supportive shoes that are in good condition and maintain healthy weight to decrease stress on the plantar fascia. Next, we're going to talk about pes planus and pes cavus. And these really aren't foot injuries per se, but they are conditions of the foot's medial longitudinal arch that we need to be aware of that could lead to other injuries. We look at pes planus. Pes planus is a flat arch, also called flat foot. And pes cavus is a high arch. When I look at pes planus, there could be two different mechanisms for this. It can be structural or functional. But remember, like I said, both of these injuries could cause further injuries up the lower extremity. So we can see in that top picture, that's pes planus, and on the bottom picture, pes cavus. So in order to remember them, remember pes cavus makes a big cave. So if you look at a cave, it has that dome shape. So that's why we see that dome shape with the bottom of the foot. So just an easy way to remember that. So we talked about mechanisms briefly, but usually it's caused over time when an athlete continually wears shoes that have too small of a toe box. For structural pes planus, this is really by birth, so they're born with this anatomical structure and they can't change it. For functional, it's caused by loose soft tissue structures, bone malformations in the foot, or nerve problems, and they're not really able to support the foot, especially the arch in this area. Signs and symptoms for pes planus. For structural pes planus, there's a flat arch when weight bearing and non-weight bearing because it's there all the time. For functional, there's an arch visible when the person is non-weight bearing, but when they weight bear, we lose that arch, or what we refer to as a fallen arch. For pes cavus, we have painful and rigid arch in that cave-like or that high arch. For treatment, if they're not really having any signs and symptoms, we don't need to care for them as much. We could treat them symptomatically if we need to. If they are having pain or another injury because of pes planus or pes cavus, then we need to refer them to a physician for further evaluation. To prevent pes planus, remember structural pes planus, we can't prevent it. They're born with it. It's their anatomical structure, so we can't do anything to change it. For functional, we can strengthen the medial longitudinal arch of the foot. For pes cavus, we want to make sure that we stretch the plantar fascia to relax it so it's not so tight, and wear properly fitted shoes with a big enough toe box that we can relax our foot in. Next, we have a bunion. Bunions are bony outgrowths that occur at the base of the medial first metatarsal, and these typically form when an athlete wears shoes that have a tight and pointed toe box, so there's constant friction and rubbing going on in that area. It can also be because of heredity as well. Signs and symptoms include the great toe, or the first toe, is angulated toward the second toe. There's a large bump, this is the bunion, on the medial first metatarsal head, and may be red and swollen in the area from that friction and inflammation. And likewise, calluses may form at the site of the bunion. For immediate care, if the athletes who have problematic inflamed bunions, they should wear shoes with wide toe boxes that are big enough for their foot to splay or to move, have them apply ice to the area. But if that bunny continues to cause pain and the inflammation worsens, then we can refer them to a physician or podiatrist, and they can further evaluate that bunion. Sometimes we can have that bunion shaved, and there's a surgical procedure that they can do for that bunion. For prevention, we need to make sure that our shoes are comfortable and they're well fitted, but if they're caused by heredity and arthritis, they may not be preventable. We might also get foot sprains. Typically, this occurs in the midfoot. It occurs to the medial, longitudinal, collateral ligaments, cartilage, and joint capsule areas. And toe sprains are caused by hitting the end of the toe on a non-yielding object, such as kicking something solid. They are also caused by stopping short or changing direction while running, resulting in the toe hitting the front of the shoe, forcefully causing it to have a sprain. Or we could be forced into a valgus or varus position. The great toe, when it is sprained, it's also referred to as a turf toe sprain, and this could be caused by forceful hyperextension of the toe when kicking. Signs and symptoms resemble any other types of sprains that we've talked about before. The athlete may have pain and loss of function in the area. The toe may be stiff, swollen, and point tender, and they may be black and blue depending on the type of force and mechanism of injury. For treatment, immediately we want to care for them with rice. We can buddy tape the toes together, which is taping the toes together to help support, anti-inflammatory medications, and crutches if they cannot bear weight. If signs and symptoms persist and they can't fully weight bear, then we can refer them to a physician to rule out a fracture of the toe. Prevention, like other sprains, we want to make sure we have good range of motion, flexibility, and strength around the area. And depending on the type of sport and activity, we want to make sure we wear supportive, comfortable shoes with an adequate toe box so there's room for that toe to move. The last kind of group of injuries that we'll talk about are to the toes specifically and deformities to the toes. Hammer claw, and mallet toe are all deformities from tendon contractures that occur in the foot. These contractures may take years to develop, but let's look specifically at each one. That top left picture is a hammer toe. A hammer toe, they're distinguished by metatarsal phalangeal joint hyperextension and proximal interphalangeal joint flexion. Claw toes are what we see at the middle bottom picture. And these are common in athletes who have pes cavus that have that increased arch, and they're indicated by metatarsophalangeal joint hyperextension and proximal interphalangeal joint and distal interphalangeal joint flexion. Lastly, we have mallet toe, and mallet toe is characterized by flexion of the distal interphalangeal joint. And these deformities can occur in one toe, multiple toes, both feet, one foot, depends on that situation. So we look at signs and symptoms. We see deformed toes. They may be because of wearing shoes that are too tight. They don't allow room for toes, for proper alignment of the toes, especially when the athlete stops and changes directions. But the athlete, for signs and symptoms, we may not be able to see the athlete be able to move their toes in a normal manner, and they feel pain when they try to do so. We may also see calluses from additional rubbing to the area. Immediate care includes wearing shoes with a larger toe box. Also, we can utilize shoe inserts to help relieve pain and pressure, and we can use range of motion and flexibility exercise in the area. If these signs and symptoms do continue, or the athlete cannot walk without pain or normal toe function, then we can refer them to a physician for further evaluation. For prevention, like other foot injuries, we want to make sure that the athlete wears properly fitted shoes with low heels and a roomy toe box. Last but not least is a subungual hematoma, and this is really what we call a bloody toenail. And it really occurs when there's blood underneath a toenail, typically that first or big toe. A subungual hematoma is caused by a direct blow to the nail or when a person stubs their toe into a non-yielding object. We could see pain within this type of injury as blood accumulates under the point tender nail, and it also creates pressure because of the increase in blood underneath that nail. So as the time goes on, once that blood fills up underneath the nail, it turns from red, and by a couple days it turns dark purple or to black. For treatment, we want to apply ice to decrease some of the pain. If it doesn't decrease, we want to refer them to a physician, and that physician will drain or actually drill into the nail and have the blood drain out of the nail from the toe. For prevention, we want to make sure that athletes are careful not to drop heavy objects on their toes and be aware of their surroundings at all times.